Is periodontal disease curable? And who wants to start?
Yes.
Go for it.
Since I'm the old one.
Since you're the old one.
Now, have you always felt that periodontal disease was curable, or is it something that going out of school you recognized, or just through experience that you've just determined that? I'm curious as to the evolution of that thought leadership.
Well, I originally didn't think it's curable, and I treated it that way forever, you know, and I knew in my mind, like as I worked longer and I was curing it, but they still say that you can't cure periodontal disease, but I did it. I knew it's been able, I mean, I've been doing it, and so it's kind of exciting to know if you can.
I want to get into those stories with you too, on what you're seeing and why you're seeing it being curable. And what's interesting, Becky, is, again, I'm gonna throw this out here, and you guys have heard me say this. What would medical do with an infection? Would they just like treat it one time and then put a patient on forever infection control protocol? And somebody, it was a hygienist in one of the trainings, said, yeah, we call it supervised neglect every 90 days. But you know, how would medical treat periodontal disease if it were treated at the ER, Instacare? Wouldn't they throw everything at it? And I want to get into that in a minute. I just want you to think about that. Is periodontal disease curable, ladies? Y'all think it is. Periodontal disease curable. That's so weird. Yes.
So I kind of feel like with periodontal disease, I think we kind of were taught, you know, like once perio, always perio. And I think there's the difference between the effects of periodontal disease and the actual cause of periodontal disease.
So the cause versus effect.
Yeah, a lot of the times we can't reverse the cause. The effects of perio.
Yeah, bone loss.
Yes. Yeah.
Sure.
Yeah, it's kind of irreversible, but we can eliminate the bacteria and the cause of periodontal disease and see health again.
Christy, I'm glad that you brought that up, because, and again, we just have an outline to follow, but I want free thinking here. I had a patient in the other day that one of my hygienists treated with Strauman's Emdogain. And he came in, and he has a tooth next to it that we need to do root canal therapy on. It's just necrosed, ancient, decrepit, disintegrating rapidly, right? So, but I looked at the tooth next to it that we had treated with Emdogain. Oh my goodness. It's like bone has grown up the distal side, furcation is filled in, kind of exciting stuff. And I hadn't seen him. My hygienist, who, you know, as you all know, I trust my hygienist, co-diagnose, treat. And I didn't see the final product. I just saw the measurements, and my hygienist said, hey, he's great. I'm cutting him loose. We got bone that filled in some of the areas. And it doesn't happen with everybody, but that's where the effect kind of, you know, we're able to grow back a little bit of bone in an area, but that's the exception to the rule, right? So you're absolutely dead on, cause and effect. What's been your experience with treating periodontal disease before you trained here at My Practice, My Business, before you were taught the protocols that we've been following since 2006? Mm-hmm. So before you were trained on it, what was your experience before in treating patients? What did you experience with root planing, perio maintenance? Anybody want to share?
Lots of bloody prophies.
Lots crime scene prophies is what you saw. Okay.
Lots of that.
You know, were patients readily, you know, 4 millimeter or less pockets, no bleeding on probing, healthy, move back to 6-month recare? Could you ever do that?
No, they tell you shouldn't.
Yeah.
They tell you shouldn't move the patient back to 6-month recare.
Because their bone is gone, so therefore periodontal disease.
Therefore, in conclusion thereof, you have periodontal disease because you have bone loss. I'm going to let all of you in on a little secret. You know how old I am? I have bone loss. You know, I mean, natural bone loss from being an old man. Does that mean that I have periodontal disease? I mean, I have no bleeding on probing. I don't have, you know, 4+ millimeter pockets, but I do have a little bit of, you know, tissue recession, and my interseptal bone is, you know, blown out a little bit in some of the areas. Do I have periodontal disease? No. Really weird.
I always say this, and you guys have heard me say that before. I always like to say that, well, I was pregnant. I might have the effects of the pregnancy with the mommy pooch, right? But that doesn't mean that I'm still pregnant. It's not going to happen. No, I haven't. But so that's what's really frustrating to me is, yeah, you've got the bone destruction, and with them to gain this another discussion. But if you don't have the other two, then you can't have the infection, and that's where it's gotten really interesting to me.
So when we started the protocol, I gleaned it from working EMS and working infections in the ER. I don't know if y'all remember me telling you about this. And just one day I'm like, why are these patients, why are we letting them run around every 90 days with infection in their mouth? And then I started putting two and two together, and that's how the aggressive treatment started. And with my hygienist Annette, and we started putting two and two together, and our patients were getting healthy. And we were moving them back to 6-month recare. Now, I don't want to get ahead with everybody, but we have over 200 documented cases of patients with full-on periodontal disease, treating them aggressively, how we do here, and we have 7 that have fallen back is all. All the rest are on 6-month recare. So what I'd like all of you to do is, like we were chatting about earlier, Ashley, tell us the story about your patient that you treated, went to another office, and I don't want to give it away. Go for it.
So I had a patient I diagnosed with periodontal disease. He had active pockets, active infection, but he came in with a kidney transplant paper for me to fill out. Hey, I need you to sign this. And then there was boxes, and one of the boxes said that he had to be free of periodontal disease or any infection in the mouth.
Isn't that funny though? Medical, you've got to be free
medical.
of periodontal disease before they'll do certain surgeries.
Yeah.
So there must be some systemic link that medical sees, and yet why are we not aggressively treating periodontal disease and allowing infection to circulate in the system? What are we not doing?
You know what? This is where my brain is going right now. So they're saying the patient has to be free of periodontal disease, but if you were in any other office that once you have perio, you always have perio.
Ashley, would you have been able to? Okay.
How does he get the needed treatment then
Right,
if you
if he
always
always
have
has
the
it.
Once you have
infection?
perio, you always have
I mean,
perio.
and I feel like that just goes to prove the
It's
link.
controlled.
Yeah.
He still has it, but it's controlled. Okay, keep going, Ashley, with your
Yeah,
story.
I mean, I think just what you guys are saying, it absolutely just shows the link of oral and overall care, which is what we're all about as hygienists, right? And that's what we learned about in school, and so that's what we teach our patients, and that's what I taught him. And I said, okay, I can treat you for your periodontal disease, and I'm not going to sign it until you have no pocketing and no bleeding in your mouth. And they went forward with treatment. I started him. I even did the whole cleaning, everything.
How much was the treatment that you proposed?
I think it was about $2,500.
About $2,500 out of pocket.
Yeah,
Insurance would pick up the rest.
Mm-hmm.
Interesting. You mean it wasn't like $1,400 like we typically see around here?
Right.
Weird. Okay,
Weird.
keep going. Anyway.
Yeah. So I treated him, and we were starting to do the recare process, and he also had 2 teeth that needed to be pulled that were infected as well. They were like broken at the gum line, decayed, everything. So
Sure.
Dr. Baird and I talked together. Hey, we let the patient and his wife know, hey, we're not going to sign this paper until this is treated. So I don't know what happened between after the cleaning and where they changed, but at some point they changed.
So you had him on multiple therapies
Yeah.
that you had him come back. How many weeks?
Every 6 weeks.
6 weeks.
After,
That's so weird.
not every 3 months.
Not every 3 months? Okay. And just so we're all on the same page, everybody watching this, medical brings back somebody with an infection on the arm, leg, wherever. They bring them back every 10 days. And they anesthetize, wire brush the wound instead of a regular soft bristle toothbrush. It's a wire brush. They, before they even start, they get a culture on the infected wound, right? Yeah. And see what bugs are fighting, and antibiotic ointment and systemic antibiotics, and bandage it, and back in 10 days for a repeat. That's so crazy, right? Why would medical treat it like that? And the average patient takes 5 to 7 visits in a wound clinic. Okay, so you're on what number of therapy are you on?
I believe it was like after the cleaning, I think he'd come back maybe once or twice, like for
Okay.
the 6-week recare. So I was
Gotcha.
kind of
Yeah.
in the middle of it. He was still not improving his home care all the way either, but I don't know what happened, but
But you got him down to where he was at least looking almost there.
Yeah. Like if he had allowed me to keep treating him, then I think I could have, reduced pockets, all of the things, as long as he was doing his end of the deal too, right? The home care.
Of course, yeah. They have. Why do most patients have periodontal disease? Their home care sucks.
I mean, I always explain it that we're a team. I do my professional care, you do your home care. It's equally as important.
Yep.
And he knew all that. I explained everything all up front, and him and his wife decided to go to another office. I don't know why. I thought we were all on the same page.
Because you wouldn't sign him off right away.
But I wouldn't sign him off. That's
why.
the thing.
He was so close, though, from what you had said.
I mean, a few months later, I would have been like, ding.
Back to 6-month recall.
Yeah. And Dr. Baird and I discussed, we're not going to sign this until he does what he's supposed to do on the form. And, we're not risking our license or our end of the deal on it. And so he decided he wanted to go somewhere else. And they told him he didn't have perio, and they signed his paper.
So weird that you did all the heavy lifting, hard work.
Yeah.
And his home care is improving. He's just right there. And now he goes to another office. Oh, you don't have periodontal disease. Well, that's what happens to my patients once we move to 6-month recare. They move out of state or somewhere. They're not diagnosed with periodontal disease.
Yeah.
They're on solid 6-month recall. Another story. Lay on another one. Give me another one of patients that you've treated, and what has been the outcome. Well, first of all, let's back up. When all of you treat periodontal disease, do you just start treating it without knowing the type of bacteria that you're faced with? What do you do? Kind of test your own
saliva samples.
Saliva sample. That's so weird. Okay. And what does that saliva sample say to you when you get it back?
It tells us like what bacteria are most active in their mouth so that we know what modalities we need to use to fight it.
What are the modalities? I mean, most offices, they're not using antibiotic directly in the sulcus. They're not doing systemic antibiotics. So
yeah, the systemic antibiotic, the local antibiotic, we do lasers in our office, but also like what mouthwashes are going to respond? Is that bacteria best going to respond to? What, are there certain toothpaste or oral probiotics? Like those types of things are all helpful as we treat in an effort to get rid of the disease.
So you're basically treating it like medical would treat it, and not like traditional dentistry. How do y'all feel about treating periodontal disease traditionally before you came through training? What was your experience treating it traditionally?
I felt like it was almost like our hands were tied because people are so used to be treating it how insurance treats it, not how they need to be treated.